Welcome to the midwifery-led unit in Ashford, and during this section, in section 2, we're going to be looking at the pre-labour, first, second and third stages of labour. Pre-labour, or the latent stage of labour, is the start of your journey, and obviously there'll be lots of questions that you'll want answered, and of course there's lots of things that you can do at home before you come into the hospital. So at this stage of labour, this can be the most challenging and the most difficult for some. It can actually last between 24 and 48 hours, and during that stage you often have regular contractions, and for most these contractions can last for a relatively short period of time. However, it's the strength of them that actually makes the difference. Understandably so, when you're expecting your first baby, you'll be wondering what you can actually do at home to help during this stage. And things that you can do is to eat well, drink and rest as much as you possibly can. And of course, really, really important is lots of support from your partner. So, what's actually happening then at this stage? Well, this scientific piece of equipment here, which is a little bit of plasticine, demonstrates nicely the cervix, or the entrance to the womb, and normally it's roughly around about this size, and it feels as firm as your nose, and in the latent stage of labour it needs to soften so it's like your lips. During this stage then the cervix will then start to shorten, and it's often called effacement, and you may have read that in the books, or your midwife may have spoken to you about effacement. And when that happens, the cervix will start to open and the mucousy plug can come away. And so during this process you may find that you'll have what they call a show, which is a mucousy show. It can be a little bit bloody, and it can be sort of a sludgy colour, but it's quite reassuring that when you have a show that this process has started to take place. And eventually, during the latent stage of labour, this eventually shortens and opens. Your contractions become more regular and stronger, and your first stage will begin.